pleased to introduce today's speaker from the Alzheimer Society of Oxford, Rhonda Crouse. The webinar today is offered in partnership with the Alzheimer Society of Ontario in recognition of Alzheimer Awareness Month in January. Rhonda was captivated by older adults early, hearing their diverse stories as an employee and a volunteer in long-term care. Her educational achievements include a BASc in Gerontology and a BSW with an award of distinction. Rhonda has enjoyed her career at the Alzheimer Society of Oxford for 17 years. She is the First Link Care Navigator for an amazing team. Rhonda is grateful for the older adults who generously let her in to their lives. Welcome, Rhonda. I'll turn it over to you now.
Thanks, Susan, and welcome everybody. Thanks for joining in with us today. I'm really happy to be here and sharing with you what I can about knowing whether the person you're caring for is experiencing a dementia or not. So to start, I would like to First, I would like to thank the education program sponsors of the Alzheimer Society of Oxford County, where I work. Without the sponsorship of these organizations, we couldn't offer education programming like we do. I also want to let you know about our learning objectives today and the goals I've set out for us to talk about today. First, we're going to learn about recognizing the symptoms of dementia and using the Alzheimer Society of Canada's 10 warning signs tool. We're going to talk a bit about different treatable conditions that can mimic or worsen the symptoms of dementia. And we're going to review some common medical tests that are usually asked for by your healthcare team when dementia is suspected. We'll talk about the benefits of seeking an early diagnosis, but also the risks. We'll talk about recognizing stigma and ageism in our community, in our healthcare system, and sometimes even within ourselves. And we'll talk about some ideas for advocating for ourselves and for the people we're caring for. And then toward the end, we always at the Alzheimer Society like to promote brain health, and we'll talk about how we take care of our brains, whether we are experiencing dementia or not. So I just like to spend a little bit of time going over some shared vocabulary because there are some common questions we get at the Alzheimer Society. So first I want to talk to you a little bit about dementia and what we mean by dementia. Typically, dementia refers to a set of symptoms. So I like to use the analogy of something like chest pain. So you might have a symptom like chest pain, and you might go to your doctor, and your doctor might do some testing and say, well, you know, there's either a heart emergency here, or you've ate some spicy food and you have some heartburn, or there's some muscle pain. There could be other reasons for for chest pain. And so it's sort of similar with dementia. So we go to our doctor or healthcare provider with some symptoms. The symptoms are of dementia, and we're looking for both reversible and irreversible causes of those symptoms. And so one of the very common irreversible causes of dementia is Alzheimer's disease and vascular dementia and various other types of irreversible dementia. We are called the Alzheimer Society, but we serve many people with many different types of dementia. But typically we're looking to serve those with the irreversible types of dementia. We also, you may have heard the term, or I may refer to mild cognitive impairment. Mild cognitive impairment refers to a change in memory or other thinking ability that's more than what we would expect for your age, but not significant enough to be called a dementia, or not significant enough to really interfere with your day-to-day life. Our friends who are psychologists and psychiatrists and other colleagues use the DSM guide, and so dementia is referred to as major neurocognitive disorder, and minor neurocognitive disorder would be similar to the mild cognitive impairment. for our purposes anyway. So I also want to just think about the language we use around care partners, caregivers, and family members and friends. In my experience, most of the time, folks with very early symptoms or folks who are in the early stage of irreversible dementia, the people connected to them often don't at that stage identify themselves as caregivers. They'll say, you know, I'm his wife or her daughter, and wouldn't at this stage refer to myself as a caregiver. So always sensitive to those issues around language, and try to match the language that that family would like us to use. I want to be clear about my scope and my role. So I am a registered social worker, and my purpose in this presentation is to give you some education so that you and your family can recognize symptoms of dementia and self-advocate as needed. I cannot provide you with medical advice today, nor can you at the end of this presentation know whether what you're experiencing is a dementia or not. So please contact me after the presentation with any general questions you have, but any direct specific health questions you have need to be directed to your primary healthcare provider. If you don't have a provider, you can call Healthcare Connect or visit the website there for some help in connecting to a primary care provider. I also want to recognize my bias, and over my time serving people with symptoms who are seeking a diagnosis, a large part of my career has been in Oxford County, Ontario, with our centre in Woodstock that's kind of wedged somewhere between Kitchener, Waterloo, and London. And our specialists are out of London as well. And so recognize that my experience and the resources that I'm aware of are within that geography. So I'd just like you to take a minute to reflect. This isn't a poll question, but just amongst yourselves, take a minute, reflect why you joined the webinar today. Perhaps you notice symptoms in yourself. Perhaps you notice symptoms in a person that you're caregiving for. And so you might have a little list in your mind of the things that are concerning to you, or you may have written something down. And we'll just ask you to reflect about that, and then we're going to compare to Alzheimer Canada's 10 warning signs. So these 10 warning signs, I've got them listed here, and I'll spend some time talking about them, and you can also refer online. I know that they'll share the link with you so that you can read more from Alzheimer Canada's webpage. But these 10 warning signs are very commonly experienced by people who have an early dementia. So the first one is, and the one we're most commonly asked about definitely, is memory loss that affects your day-to-day activities. So we all from time to time have some memory loss. I know I do, but we're talking about memory loss that really affects your day-to-day tasks. So, you know, maybe that is, you know, I sat down this morning and had a conversation with my partner and just completely forgot that conversation later on tonight and didn't do what needed to be done. It could also be that you have memory loss, but you are able to use tools. So maybe I meet with my partner this morning and I write a little list because I got a lot of things to do. So I write a little list of what I need to do, and then I'm able to remember it. That may not be as concerning as if I was to write a little note to myself and then never remember that I made that note and never remember to check it. And so it's not only memory loss, but memory loss that really affects our day-to-day activities, and often is a type of memory loss where sometimes those memory tools that we all use start to fail. Also, a second symptom is difficulty performing familiar tasks. So different tasks are familiar to different people. I think of the example of somebody who can build a deck. You know, you might be used to building decks. You've built lots of decks in your life before. Maybe you're sitting down in this winter weather and planning out a new deck, and just find that in making those plans and thinking about the measurements, you're really struggling a little more. And then when it comes time to build the deck, there are mistakes that are unusual for you to make that are made. And so that might be a difficulty or a symptom that you're noticing. Another symptom is problems with language. And so this can be getting stuck in the middle of a sentence, substituting a word that you didn't mean to say. Again, those are sorts of things that we all do from time to time, but it's usually to a greater degree when we're concerned about dementia. So you might think of somebody who has always been a fantastic speaker and they're having trouble with language, or somebody who's been an author or a writer and they're having trouble coming up with the words in doing their writing. These would be some changes in language that may be an early symptom. Another symptom is disorientation in time and space. So maybe coming home from the grocery store you always go to, and maybe even momentarily, you don't recognize the neighborhood or recognize the street that you're on. That would be concerning and potentially a symptom of dementia. Impaired judgment is one that can come up quite often. As an example, could be dealing with finances. Maybe somebody who's always been careful financially starts to spend a little more elaborately, or somebody who's always been a spender is spending much less. Could be related to getting dressed for the weather. So on a very cold day, not putting on the clothes that typically we would all put on to protect ourselves from the cold. Also, number 6, problems with abstract thinking. So that might be balancing your checkbooks, managing your investments. It can also be understanding phrases or slogans. So somebody might say, the cat's got your tongue. And, a person might take you very literally and think, well, no, the cat didn't do anything, instead of realizing that by using that phrase, what you meant was that, you don't have as much to say as you usually do. So those kinds of problems with abstract thought and abstract thinking can come up. Misplacing things, we all do it from time to time. We even all put things in strange places. I know recently I put the cereal in the fridge and the milk in the cupboard. It can happen to all of us, but typically early in dementia, it's happening more often and happening more with sort of strange locations of things getting misplaced. Changes in mood and behavior are very common. You might see somebody acting more depressed, being less interested in things, not having the same motivation that they did, perhaps more quick to temper or more easygoing than they used to be. So different changes in mood, behavior, and personality are also common. And loss of initiative is there as well. And I think I mentioned that briefly, that, I've had a number of clients over the years that will say things like, my get up and go has just gone, just not having the same initiative or motivation. So when we have the symptoms and we recognize some of these symptoms, we then turn to look at, okay, these are the symptoms, these are the things we've noticed, these are the changes. So what kind of conditions can mimic dementia? So what can look like dementia but not be dementia? And you can see here on my slide that there's quite a list. And again, I'm a social worker, not a medical professional, but when we take our list of symptoms to a medical professional, what they're doing typically, and people will say to me, why is it taking so long? It's been a year of different tests and things. Well, it's often because we have to look at all of these potential treatable conditions that could be mimicking or looking like an irreversible dementia. But if we can treat them, then potentially we improve the symptoms. And that's the real benefit of seeking early diagnosis, is that we get the opportunity to treat the treatable things. So there's thyroid conditions, nutrition deficiencies. A real easy one is sensory impairment. So hearing loss is very common, but as a general rule, we aren't as good about getting our hearing tested as we are about vision. So lots of folks that I know will go and get their vision tested every year, as they should, or maybe every 2 years. But when I ask, have you had your hearing tested? No. So that's something to think about. That's something that you can do even without a doctor or nurse to prescribe or to order the test, is to think about hearing loss and sensory impairment. There's also stroke, hydrocephalus is like a fluid on the brain, depression or other mental health issues that also carry some stigma but are treatable and not a progressive condition like an irreversible dementia. Prescription and over-the-counter medications can mimic dementia. In my work in memory clinics and in following some people as they go through these medical tests, I often see people coming off of medications more often than going on medications. But that's an important topic to talk about with your pharmacy team and your physician. Alcohol dependence, overuse of alcohol can mimic and worsen dementia, as can sleep apnea, which is a condition where you don't get a quality sleep because you're waking up every so often because your airway is obstructed and you can't breathe. So that often involves an overnight sleep study to diagnose. Different infections, tumors, heart and lung problems, and stress. And stress is a common one for the group that I'm speaking to today. As caregivers, we often have so many things on our plate, and having a lot of stress can make our memory appear worse. And so managing stress is an important part of managing stress properly is an important part of like ruling out a condition that could look like dementia. So when we take our symptoms and we think about all these other medical conditions that could be affecting our memory and giving us the symptoms, we look at the common medical tests that are often ordered. So ADRD, we mean Alzheimer's disease and related dementia, is a clinical diagnosis often made after the process of elimination. So most of the time our physicians, nurse practitioners, healthcare team, they're using their judgment. So there isn't a one and easy test. It's not one brain scan. It's not one blood test. It's a combination of things and a clinical diagnosis that is made after the healthcare provider is sort of ruling out these other things that could be affecting your memory or language or other symptoms. So the process often requires an interview of the person who's having the symptoms themselves. You know, what have you noticed? What's changed? Some in-office pen and paper tests. So people will tell me, yes, I drew the clock and I named the animals that they put in front of me and I connected the dots with the letters and numbers. Those kinds of in-office pen and paper tests are an important part. They tell us a lot about the different areas of the brain and how they're working. Interview with a family member or friend who knows someone well. So that would be you as caregivers being interviewed, and hopefully the interview is happening in a private location so that you feel safe to answer and be honest and open with the healthcare provider about the symptoms that you've noticed. Especially when the person maybe with the symptoms doesn't have a lot of insight into the symptoms that they're experiencing. A brain scan and an MRI is often used. I have lots of folks come to me and say, well, they did the brain scan and they found nothing, so it can't be dementia. It's not quite that simple. Usually in the brain scans, they're looking for things, more major things like tumors and strokes and hydrocephalus and those kinds of things. So when a brain scan sort of comes back okay, it doesn't mean not dementia. It means that, you know, we've ruled out again another group of some of these other things that can be going on in the brain. Blood work is a critical part. It's how they know about thyroid function and vitamin deficiencies and that kind of thing. So blood work is often taken. And they look back at your past medical history and we try to treat the treatable. So if things are identified in this process, we treat those things, we follow you over time and see whether there's an improvement or not. Also a review of medications, both prescription and non-prescription. There are medicines that are available just over the counter in the pharmacy that some people take quite a bit of that can have an effect on our memory and thinking as we get older. So not only those prescription medicines, but sometimes the over-the-counter medicines are also looked at. And again, those hearing and vision tests are an important part of the diagnosis process. So as you can imagine, all of this is, it's more than a 5-minute office visit to do this kind of testing to investigate the cause of the symptoms you're experiencing. So one of the wonderful programs available to lots of people in the province of Ontario are the MINT memory clinics. These are programs that a physician can refer to. They are all connected to specialists, but also have family physicians with some extra training, along with nurses and social workers and pharmacists as part of the team. And so it's a team approach to assessment, and they have the ability to kind of work through all of these things with you. So lots of primary care providers can refer to those clinics, but they're unfortunately not available to all primary care providers. There are regional geriatric programs in our region. Most commonly, we're referring to the Aging Brain and Memory Clinic in London, Ontario, but different centers throughout Ontario will have specific geriatric programs. And we can refer to specialists like our geriatricians, neurologists, psychiatrists. There also are in our region the geriatric ambulatory access teams, which are a neat program where when COVID is not here, they will come to your home and do an assessment and then consult with a geriatrician. So it's a bit like seeing a geriatrician in your home. And for some people, that's a really great way to go through this diagnostic process. Also mention occupational therapists because they're a great tool and sometimes are available to primary care providers to help with this diagnosis process. So I'd just like to share with you now a really important book written by people who have lived experience. These guidebooks are written by people living with dementia. This is one of their guidebooks that is written by people living with dementia for care partners of people with dementia. And in these guidebooks, people have been through the process of diagnosis, share their own experiences and their own tips, the things they would like to have known as they were going through the process, and they kindly share that with us. And so some of the comments from the book, one of the caregivers in that book says, "I wish I had known earlier that I shouldn't try to reason with my husband. Since I've stopped trying to reason and our conversations have become much more pleasant. When I disagree, we let it go, we change the subject." Another person wrote, "My mom's doctor has been protective of mom's independence and made it very clear that she is his patient and she is legally competent. Therefore, the doctor said he will not talk to me or to anyone else unless she gives permission." So some of the benefits of seeking an early diagnosis, why at the Alzheimer Society we promote early diagnosis so much, are listed here. When there is an early diagnosis, the person living with dementia has the capacity to advance care plan for themselves. So that's to think about the future and think about what they would wish and what they would want. And really, this could be another webinar on its own, discussing all of the options, but POA means power of attorney. It differs from wills because power of attorney are legal documents put in place assigning somebody to speak on your behalf if you're unable to speak for yourself while you're living about your healthcare and your finances. Whereas wills are in effect after a person has passed away. So those two are different, both important parts of advanced care planning. We can also talk about our living arrangements. So I want to stay home as long as possible, or if I have to go to a long-term care home, these are the ones that are acceptable to me and these are the ones that aren't. DNR means do not resuscitate. So sometimes in the presence of a diagnosis of dementia or in older age, a person will decide that they want to complete those do not resuscitate forms with their healthcare provider. And MAID, we refer to medical assistance in dying. So when a person is diagnosed early, they have the opportunity to learn about and potentially advocate related to MAID. When a person's diagnosed early, they are able then to provide and receive peer and family support. They have the opportunity to treat the treatable. They can seek treatment to slow the progression and preserve quality of life. So if we can boost a person's function, boost their health, so that they have a better quality of life for a longer period of time, then that's an important thing to do. So sometimes those are medicines for Alzheimer's disease, the cholinesterase inhibitors. Other times those are things that are meant to prevent stroke or vascular damage in our brain, and as well as lifestyle treatments. And we'll talk about those at the end of the presentation. When we're diagnosed early, caregivers can be informed and educated very early. And so that's an important role of the Alzheimer Society and caregivers who come to our organization, that caregivers can then be prepared for what they're doing when they're caring for the person with dementia, and receive education about what's helpful and what's not. And sometimes folks that are diagnosed early like to join our organization and others to advocate, to lessen stigma, or to advocate for services in the province and in our country. So if early diagnosis is that great, why doesn't everybody do it? Well, the truth is there are some risks in seeking early diagnosis, one of which is depression. This is a diagnosis of an irreversible dementia is a significant diagnosis. And would put a person at risk of developing something like a depression or worsening depression. Depression and dementia often live together. Protective factors can be really good mental health treatment, can be counseling, can be connecting with the Alzheimer Society for peer support. So those kinds of things can be protective. Another risk is social exclusion due to stigma. So unfortunately, still sometimes when our friends and family learn that there is a dementia there can be some social exclusion, people being left out. And protective factor and caregivers play an important role in this. Sometimes we can plan get-togethers, reach out and be an advocate in our own friendships and our own communities to keep the person included and involved. Often when the stigma lessens because family and friends get education and learn about communication tips and strategies, then people are more likely to be socially included. We also have a number of social recreation programs at the Alzheimer Society that allow people to stay socially involved. Driving is something that often holds people back from going to speak to the doctor. When we talk to the doctor or nurse practitioner about the changes, about the symptoms that we've noticed, and they engage in some of these cognitive tests, there is a risk that they will find something that causes them to have concern about our driving. And if that's the case, these healthcare providers are legally obligated to report to the Ministry of Transportation. And then it's up to us then to decide, hey, you know, I agree, I think it's time to stop driving, or to demonstrate to the ministry that we can drive safely, and to do that through a functional assessment center. So sometimes that holds people back. You know, this could be another lengthy webinar talking about driving and dementia, but I would say that whether it's dementia or any other health condition, that risk is there all throughout our lives. If we have a health condition that can affect our driving, our healthcare folks have that same obligation. So it's not only related to dementia. And also to know that our healthcare providers know what driving means for independence and health, and you know, certainly don't want to make a report. They make those reports because it's out of necessity. They feel that there really is a risk to you and other people on the road. So the other risk in seeking an early diagnosis is strained relationships. So particularly with anosognosia, that's a really long word to just essentially say a lack of insight, or that they don't know that they don't know. So when we are concerned about somebody showing the signs and symptoms of dementia and they don't see those symptoms in themselves, as caregivers, we're really in a difficult spot. We're in a difficult spot in communicating those symptoms to a healthcare provider, especially when the person is entitled as a capable person to have privacy and such with their healthcare providers. So relationships can be strained when we start to try to encourage seeking help for something that a person may not see that they have a problem with. And the other symptom of dementia that can cause some strained relationships is apathy or lack of empathy, because it can affect kind of the quality of our relationship that we've had. And also we have a risk of losing trust in our primary healthcare provider, particularly if that provider has to make a medical report about driving. We may not want to return to that primary care provider. And so that's one of the advantages of memory clinics and specialist care, is that if a report has to be made about driving, that specialist or that memory clinic can make that report, and we can preserve the relationship with the primary care provider who's needed for healthcare down the road. Stigma and ageism exists within ourselves and also within the healthcare system. And these are some examples. You know, you're over 80 now, what do you expect? Sometimes people go to their doctor and will say, well, you know that you have a bad memory, so there isn't a problem. People with dementia, you know, don't know they have a problem. So you're okay because you're concerned yourself, which we know not to be true. Often I hear, and this comes from a well-intentioned place, family, friends, community members will say, I forget things or misplace things, can't find my words all the time too. Don't worry about it. We also sometimes, when we think about Alzheimer's disease, we immediately think about somebody who can't care for themselves, but there are people with Alzheimer's disease who successfully live alone for a long time with proper supports. So you can live alone and still take care of yourself. Or other times it's just silence. You know, people will say to me, well, I mentioned it to my doctor, but the subject was just changed, or I just got a blank look. So some ideas for self-advocacy are here. I would encourage you, I mean, congratulations, you're all here educating yourself, but you can also contact your local Alzheimer Society for ideas. Look for your allies, look for the people that have ideas about how you can approach this topic. Learn about the options for medical assessment within your community so that you can ask specifically for them if you need to. Be confident in asking for your healthcare and thorough assessment. So I go back to the example of chest pain. You know, people don't usually have to advocate very hard to have their chest pain investigated. But yet with memory loss or language changes, sometimes we do, but be confident in asking for that. Also share your goals with a trusted person. Ask somebody to come with you and help to advocate. And if you go through all these tests and you're offered a medicine and diagnosis isn't shared, ask directly, you know, do you think this is dementia? What do you think this is? Why are you prescribing this medicine? I recognize that I've taken quite a lot of time, a little longer than planned at half an hour. So I'm just quickly going to review brain health, dementia or not. These are some excellent things. You can check out our website, but we want to essentially be as active as we can be, take care of our health in other ways. And when we talk about making conscious and safe choices, sometimes that's relating to falls prevention and preventing head injuries. So there's simple things like wearing helmets when riding our bikes, but also using those grab bars, using that walker that's offered or that cane, and trying to prevent falls and head injuries. And for those of you as caregivers, I know the Ontario Caregiver Organization is doing a great job working with folks to manage stress, because as caregivers, that's a really important part of our brain health, in addition to all the other things I'm sure you've heard lots about.
Thank you so much. That was a well-timed, very informative presentation, and I know our audience members are going to really appreciate it.